Hello everyone, I'm Tony Odutola, also known as Miss Bash. I'm a physiotherapist and this is Soro Soke Physiotherapist podcast. We are basically doing this to educate the public on the impact of physiotherapy on health. Yes, so I have with me one of my very wonderful colleagues. She's a women's health physiotherapist and a pelvic health physiotherapist. Her name is Tokwe Omoniyi. You're welcome.
Thank you so much.
And then here I also have with me another physiotherapist. His name is Ife Olaniyi. Ife, you're welcome.
Thank you for having me.
Esther and Tunde were a happy couple, building a beautiful life together. Tunde, a dedicated engineer, was known for his hard work and steady support. Esther, a skilled lab scientist, brought warmth, intelligence, and strength into their home.
Together, they balanced demanding careers with a loving family life, always standing by each other through every season. Their home was filled with laughter, love, and the quiet joy of partnership.
What exactly are you doing there, my love?
I'm here to assist my wife, the mother of my children.
Oh, is that so?
Yes, my love.
Babe, do it properly. Well done, Mr. Assistant.
Yes, ma. I won't disappoint.
Esther, these results from batch B look a bit off. Can you double check?
All right, let me take another look. It might need a retest.
Esther, you okay? You've been holding your back small.
It's nothing serious. Just small discomforts. I think it's pregnancy thing.
All right then. Would you like me to get you a glass of water?
Yes, that would be nice. Thank you.
Why is my back like this? Why is it difficult to turn and sleep?
Esther, you look uneasy. Anything wrong?
Just back pain. I don't really understand it.
Sorry, and please take some rest.
Thank you, I will.
Esther, please make sure you tell the doctor about your back pain at your antenatal appointment.
I will. I'll let him know.
I'm really sorry, my love.
Thank you.
Doctor, I've been having lower back pain. It started small, but now it disturbs my sleep.
That kind of pain is common as baby grows. But I don't want you relying too much on medication.
But what can be done to reduce the pains? Because this is becoming unbearable for me.
I understand how you feel.
We had a physiotherapist who once educated our antenatal patients on posture. I think you should see her.
Physiotherapy, will it help me, doctor?
Yes, very helpful in cases like this.
All right, doctor, I will follow your advice and visit the physiotherapist.
That is good.
At the physiotherapy department, Esther was warmly welcomed. This was the beginning of a journey toward relief, recovery, and renewed comfort.
What is this tape for? It helps lift some weight off your lower back. Let me see how your posture is affecting your lower back.
Okay, physiotherapist.
Don't sit without support. Your back must always be aligned.
Oh,
I didn't know this was important. Yes, let me show you. It feels like someone just took a heavy load off my back.
Esther, you're making really good progress. But beyond treating this back pain, there's even more we can do to help you prepare for delivery.
Really? We have antenatal physiotherapy classes designed specially for expectant mothers. In these sessions, you'll learn exercises, breathing techniques, and body positions that can make pregnancy, labor, and delivery much easier.
That sounds helpful. I honestly didn't know physiotherapy covered all that.
Oh, it does. It helps you stay strong, manage discomfort, and prepare your body for childbirth.
Then I'm definitely interested. I'd love to join. Excellent choice, Esther. I'm sure it will be one of the best decisions you make during this pregnancy. I already feel better knowing I'm doing the right thing for myself and my baby. Thank you, physiotherapist. I will be joining the classes.
Every week at the antenatal physiotherapy class, Esther was taught important techniques to support her body. She learned pelvic floor exercises to strengthen her muscles for delivery, in breathing techniques that would help her stay calm and in control during labor, and gentle stretches designed to reduce the risk of tearing and prepare her body safely for childbirth.
Today, we'll focus on gentle strengthening and breathing techniques to help you stay comfortable and prepared. I feel more prepared already. Tunde, it's time.
I know, stay strong. I am here with you.
Thank you, my love. I love you.
Good, Esther. Push gently.
Esther was calm, focused, ready.
I can do this.
Breathe, Esther. Good.
Almost there, push.
Within 30 minutes, her baby arrived.
I never knew physiotherapy could make pregnancy and delivery this smooth.
I'm just grateful you are both fine.
I'm so grateful I met the physiotherapist. Physiotherapy was a lifesaver in my journey. It made my labor so much smoother and more comfortable. I'm so glad I did this. It wasn't just pain relief. It gave me strength and control.
So we just watched a video of Esther, a 35-year-old woman who was 24 weeks gone. She had terrible back pain that was excruciating. But you know something? Physiotherapy does have a role to play in things like this, because as a pregnant woman, you can't, you would have remembered when the doctor said, I don't want you to be on too much medication. Yeah. But she needed solution to that problem. And these things do happen. That's why I have here with me Tope Omoni. Tope, please share with us what the role of physiotherapy has been with managing back pain in pregnancy. It's something a lot of women need to know about. Over to you.
Okay, my name is Tope Omoni again. I'm a pelvic floor specialist as well as a women's health physiotherapist. Okay, I've been working in this field for about 5 years now, and I've seen a lot of pregnant women. A lot of them, because I work in a general hospital, so of course, a lot of them come in. And one of the major complaints they have is actually back pain, apart from other complaints like waist pain, shoulder pain, wrist pain, pelvic pain. Those are the type of pain that some people term as normal in pregnancy. Wow. They'll say it's normal. As a pregnant woman, you should have some of those type of pain. No. But I always tell my mothers, like I call them, that it's actually not normal, because there are things you can do about this pain and it will go away. It will go away. Instead of swallowing medications and different type of things that the doctor will probably prescribe for them. Okay, so physiotherapy deals with movement, posture, motion. All these things have a big impact in the way the muscles are aligned to prevent pain.
Absolutely.
And this is what we teach in physiotherapy. We teach them the right things to do to avoid these pains. And those already having these pains, we teach them what to do to make these pains go away without swallowing medication.
Pills.
Yeah, and another thing with that medication is that sometimes it affects the baby.
Exactly.
So when you're trying to solve a problem for yourself as a mother, then you're creating another one
Another
for the child.
problem. That's
It's
why
not
it's
okay.
just important to just look for means and methods to relieve pain without having
taking
to
these
use medication.
medications, yes.
And that brings me to some things that really struck me in that video. You know, at the time she was referred for physiotherapy, she went to the physiotherapy department. The physiotherapist, first of all, I liked what that physiotherapist did. Patient education, because the patient or the client needs to understand the problem.
Yes, it's
because
key.
if they don't have an understanding of what is going on, do you understand? So
their confidence will be affected.
Exactly. So she had to explain, and when she explained everything to her, she now started to teach her. Because that, you know, physiotherapy is a very interesting profession, because we don't just only just treat, and then, okay, go, come back. No. We spend time to talk to the patient, to teach the patient.
So that they understand.
Because if the patient or the client doesn't have an understanding of what you're talking about, they won't get better.
Yes.
Because they are primarily with themselves more than they come to the hospital or to the clinic or to the physiotherapy center. So one thing that really struck me was the moment the physiotherapist taught her about her posture, breathing techniques, stretches, exercises, and positioning. One thing that struck me was the taping technique. A lot of people are even confused about it. I remember a patient, when I think I met you that day, and I was saying that, you know, that patient went to see a O&G doctor.
Yes.
And the doctor was like, what is this thing that they tie to your stomach? It was so funny. Like, she was like, and you know, she now has to start educating the O&G doctor that, oh, this thing that they put in my tummy,
it has made a difference,
it made a
honestly.
huge difference. Exactly what Esther felt when the physiotherapist did that taping technique. It actually takes a whole lot of weight off the back, and it relieves pain. Please share more and shed more light on this.
Okay, the taping technique we use in antenatal physiotherapy to help to relieve pressure, especially on the pelvic floor. Let me put it that way. Apart from that, it also helps to relieve pain on the back. Okay, so it takes the weight off so that the mother is now able to move easily without having to bear unnecessary pain. Okay, so what we do is use that tape there's a way we apply it, which of course I'm not going to.
Technique.
It's a specialized way of doing
is.
it. And then you have to do it in that specific way in order to achieve the result, which is to take the weight off the pelvic floor. Yes.
Yeah, and I
the
think
back
another
also.
thing that makes it easier for you to understand what she has said is that tape actually just mirrors a muscle.
Exactly.
So it is just trying to like do the work of an extra muscle.
Exactly.
You know,
At
that
that
helps
point
to
in
carry
time,
the
because it
baby
gives
properly.
support.
Yes.
So that's just it.
Absolutely. It gives support. And people need to know about things like this, because apart from just learning, positioning, some kind of exercises to do, support is another key area in physiotherapy.
Yes, it is. Very
Oftentimes, you know, I would share my own story. When I had my daughter, you know, when I was pregnant with my daughter, I think around 23 weeks or thereabout, I had this terrible back pain. It was excruciating. Like, I couldn't sleep, just like the video we just watched, you know, what Esther experienced. You know, at that point, as a physiotherapist, I was thinking to myself that I now know what my patients are feeling. I couldn't sleep. I was so worried. Then I now had to put a call through to one of my dear colleagues. She's a women's health physiotherapist as well. And I told her, I said, I can't sleep. What do I do? What do I do? So she said I should just calm down. That when I come to the office the next day, she was going to do something for me. So when I got to the office and I told her that I couldn't sleep last night, the pain was so bad. She now recommended this pregnancy support belt at that time. So I used it, and alas, there was instant relief. So that is to tell you that support is a very key area in managing pain. So back to you, Tokwe. I know that it isn't just pain that you address in your antenatal physiotherapy classes.
Sure.
You also address certain stretches that should be done to ease labor.
Yes.
Because I remember a lady sharing with me that because her first child, she didn't have physiotherapy antenatal class with her first child. But by the time she was having a second baby, she started having physiotherapy. And there were certain stretches and techniques you were teaching them at the time. And there was a particular kind of massage. They call it perineal massage.
Perineal
where
massage.
they teach the woman how to massage the vagina. Vaginal massage.
Vaginal massage.
Perineal massage. You know, some of them call it vagina, but it's not vaginal massage. It is perineal massage. In fact, I remember a particular class when you said your husband can do it for you.
Of course.
When they start that one, they'll just start other room. The other room activity.
The other room activity is also important at this stage of pregnancy, actually.
So that woman actually shared her story, saying that all that exercises, stretches, and perineal massage, everything that she learned in that class, she was able to have her baby seamlessly. She had no tears, she had no episiotomy. And in my mind, I'm like, wow. So that is the impact of having to attend antenatal physiotherapy classes. Please shed more light on that.
Okay, as a pregnant woman, it is important you see a physiotherapist. Why? Because for all you know, there might be some groups of muscles that may be tight, some group of muscles that may need strengthening to help your labor to be seamless. Just as that woman illustrated in the video. It's important that you see a physiotherapist who will properly assess you and know the right type of exercises for you to do while you are pregnant. For this example you gave, that woman came in, the first pregnancy, she probably had a lot of muscles tight, and she didn't know what to do. She didn't even know how to go about it. But with the second pregnancy, we taught her the right stretches to do. She was able to do those stretches consistently, which is also very important.
Consistency
I always tell
is
my
key.
mothers, consistently.
Not come today, don't come tomorrow. Come today, I won't come next week.
You have to be consistent
have
with
to be
those exercises.
Absolutely.
And once you are doing it consistently, you will see the results. It's amazing. Physiotherapy is beautiful because you see the results and then it shows because our birth was so much easier. Now, you mentioned perineal massage. Yes. And you are right.
People are really interested in that.
Perineal massage is something the husbands should be doing for their wives. It's very, very important because research shows.
But it can promote other room activities.
Well, like I always say, other room activities is also good at that stage in pregnancy.
Yes.
It is important that the other room activity is done frequently.
I support
I
that.
agree.
I actually support that.
Perineal massage, it helps to keep that place pliable and stretchy. So it allows the baby to come out easy.
So how does the man learn? I mean the husband. How does he learn how to do that?
The men want to understand.
Okay, what we do in the antenatal classes, we teach the women how to do it. Okay, and then they get home and teach their husbands how to do it. Yes.
Interesting.
That's fine.
Okay, that makes a lot of sense. So I would say that physiotherapy in pregnancy, that's antenatal physiotherapy, that is when you are teaching a woman the things she needs to do, what she needs to know, isn't just the woman learning everything. So the role of the man is very important. So if I shed more light on support that husbands should be giving their wives in pregnancy as a physiotherapist.
Okay, so I feel like men should actually get more involved when it comes to this issue of pregnancy, you know, involving their wives, because a lot of men just feel like, I've already paid for the antenatal care, so you just go for it, and then when is the D-Day ahead, then I'll get involved. But I feel like it's not good that way because pregnancy has a lot to do with the mental state.
Absolutely.
You understand? And it goes a long way when the woman sees that you're actually supporting her mentally, you're giving her words of affirmation, you're encouraging her, and not just be like, I have to go and make money, I've paid for your antenatal, I beg. And that's what a lot of people do.
And antenatal classes with their wives.
Yes,
I have a lot of men that do that actually.
That's
they
wonderful.
Come in with their wives and sometimes they attend the classes, they listen to the educational talks, and they even remind their wives when they get home about this exercise.
You are not sitting.
You are not doing it properly.
You are supposed to sit this
exactly.
way.
And then another thing that does to you as a man is that it makes you have a better understanding of what the women go through. Because when I was doing my internship at Lagos Island Maternity Hospital, so there was a particular one I attended, and the men were told to put a balloon in their shirts.
In their shirts.
So they were told to pick something from the floor.
I'm sure they
So
will find
because
it.
of that balloon, it wasn't
barrier.
easy to,
For them to actually
so
do
some
that.
of them now had that
They
understanding,
had an understanding
that,
of what their wives were
okay,
going through,
which is actually a good thing.
which is remarkable. For men to be participatory, they need to also join their wives for these classes. And I would say, and I would like to advise the public, if you know anyone that is pregnant or is attending antenatal classes in any hospital, let them look for a physiotherapist in that hospital so that they can be better educated on the things that they need to do. But if you also need more information about things like this, or you want a personal experience, you don't want it to be in a public space, you can always reach out to us, because this podcast is primarily sponsored by Peakline Care. This is something that we do. So if you need help with this, you can always send us a message, reach us on the link below this video, or send us a message or an email. So back to the benefits of women's health physiotherapy. I would want you to touch a bit on postnatal care, because this is an aspect that people ignore. I remember vividly one of my colleagues, a very sound women's health specialist, she was sharing with me at the time that there are a lot of things that happen post-pregnancy. We have uterine prolapse, we have incontinence, back pain, pelvic pain, pubic symphysis, diastasis, a lot, postnatal depression. So a lot actually happens after pregnancy. And the truth is, some of our mothers, they didn't know about these things. So they would just tell us that, oh, it's normal. But it's not normal. It's not normal to live with pain. Like why? I should live a normal life. After I've had a baby, why must I be enduring pain? Because I personally had a lot of issues, particularly with my sit bone at the time. Anytime I sit for like 30 minutes, it hurts badly. So I had to do something about it. Of course, I'm a physiotherapist. I had to work with my colleagues. We had to do some certain stretches, exercises, and I got better. So please tell and share with us what you would like the public to know about postnatal physiotherapy care.
Okay, postnatal physiotherapy care is care after delivery. Now, the truth is that the woman's body goes through so much in pregnancy.
It's actually a lot.
A lot of the hormones.
Yeah.
I don't want to start mentioning names, but they have this effect on ligaments, on muscles, giving them that laxity.
Absolutely.
And the effect is felt even after delivery, because the structures, the bones, they are not the same. Okay, so ideally after delivery, it is proper for your wife or the pregnant woman to see a physiotherapist for postnatal assessment. Okay?
Very important.
It's so important, because
Very
especially if
important.
you are planning to have another child. Before you go into having another baby, you should make sure that the muscles that are going to be responsible for carrying this pregnancy, they are strong and able to do that. Because the effect kind of ripples over if you don't address the issue at that point. Now, if after giving birth you have pain, you have issues, please see a physiotherapist. See a physiotherapist. We know exactly what to do. After the assessment, there is no tailored treatment. We'll know exactly what you need and we'll be able to address what.
And there's something else I noticed. Some people feel like it's a very bad thing to have a cesarean section done. So they will tell you that I want to give birth like an Hebrew woman. And one thing I noticed when I was doing my internship in Lagos Island Maternity Hospital was that they always check the size of the baby to know if it's okay enough to pass through the birth canal. So if it is not like okay, they will just tell the person to opt for a CS. So, but some people would say no, regardless. You see, I want to give birth like a Hebrew
that's
woman.
why we have platforms like this to educate the public, because one shouldn't really demonize any kind of delivery, whether it's spontaneous vaginal delivery or say a cesarean section. But I would say that there is still some benefit to having to see a physiotherapist prior to delivery. I would say this because I particularly shared a story with a women's health physiotherapist. I was telling her that, the baby was weighing 4 kg. They saw it on the scan. They would have just opted for a cesarean section. But she said, you know what? even if the baby was weighing 4 kg, there is still something. She's a specialist, actually. So she was explaining to me. She said there's still something a physiotherapist can do in order for that mother to birth that baby, even without doing a CS, and have the baby, through spontaneous vaginal delivery, and everything is going to be perfect. And I'm like, seriously? She said, yes. So people just need to be educated on these things, because a person may find herself in a place where they may not have access to a hospital where she can have a surgery done to bring out the baby, and the baby is big. So in that kind of situation, what do you do?
It's about
But if the mother had been prepped up through antenatal physiotherapy classes, then such delivery can happen without complications. So it's
and then one of the most common causes of having a CS is actually when the baby is breech. Okay, and that's one other thing that we need to talk about. Okay, having a breech presentation in a child while the baby is still...
By saying breech, you mean like maybe
the
wrong
baby
position?
Yes, wrong position.
Yes.
That means the baby is maybe coming with the bum, with the leg, or the head is not down. Let's just put it that way. Once the baby's head is not down, we say the baby is breech. If such a patient or such a pregnant woman sees a physiotherapist early enough, there are actually exercises you can do to help turn the baby.
Okay, so now we're talking about the position of a baby.
Yes.
Like when the baby is in the breech position.
Yes.
So you are saying that a physiotherapist can actually do something about that?
Yes, that's what I'm
please
saying.
share this with us. So they need to hear.
Okay, I'm
let's hear
saying
from
that
you.
if the timing is right, that is why it's important that as a pregnant woman, as the father of the pregnant woman, or as the husband of the pregnant woman, make sure that your woman is attending physiotherapy and antenatal classes. Because those are the type of things we pick up on time and we address. If the baby is breech, there are actually exercises we can do to help turn the baby.
Wow.
If the timing is right.
If the timing is right.
If the timing is right.
Yes.
So you see why it's important to engage a physiotherapist. See, the moment you do a pregnancy test and you see that you are pregnant, please just call a physiotherapist ASAP. Don't waste time, because timing is very key. They are trained professionals. They know what to do. They ask questions. They do assessments per time. And when it's time for you to do certain kind of exercises, they will tell you when to do it. And the exercises, of course, they are safe.
Very safe.
They are safe. It's not something that would cause any sort of miscarriage.
And they are research-based, evidence-based
practices. That's what we do as physiotherapists. So I would like to say that, the women's health physiotherapy specialty is a very interesting one, because it isn't just about antenatal care. It isn't just about postnatal care. We also care for people having gynaecological conditions, like dysmenorrhea, uterine prolapse, vaginismus. We have people that when they get married, they can't consummate the marriage because the vaginal muscles are extremely tight. So that's vaginismus. So these are things that a women's health physiotherapist does, or a pelvic health specialist. That is what they do. So you need to be educated on these things. Not everything is taking pills. Not everything is surgery.
ChatGPT.
Or ChatGPT. Or Google, Dr. Google. No. Sometimes some people just resort to, okay, I have to do a surgery. Or, I have to take pills. No. Sometimes these things are mechanical. They need to be sorted in wherever the dysfunction is happening, it needs to be fixed. So that is what physical therapists or physiotherapists do. I believe this session has been very educative, and I understand that, a lot of people are not aware of who physiotherapists are and what we do. Some people call us Ato Egun Yorubas. They say, what is Ato Egun? Some of them call us Ato. We are not toy any Egun. We are not arranging bones. There are some people call us massage. I want massage. No, we are not masseurs. No, we are physiotherapists, physical therapists. So physiotherapy is basically a dynamic profession where we use different modalities to treat different conditions. Treat conditions through exercise education. We treat conditions using physical methods. physical methods. That is who we are. And I believe this has been very educative. And I look forward to seeing you another time. And once again, Tony Odutola, also known as Miss Bash. See you some other time. Sorosoke Physiotherapist.
Bye, guys.